Start first here, new at 11, with that race to vaccinate. A lot of you might be keeping a close eye on what happens next week.
That is when a whole new age group could finally be allowed to get a COVID vaccine. The FDA could amend Pfizer's emergency use authorization to include younger children 5 to 11 years old. The agency is meeting on October 26th to review the data.
If the FDA and CDC sign off, elementary schoolers could start getting those shots in November. And of course, that includes kids right here in the Carolinas. And tonight we learn just how many doses for kids are headed to Mecklenburg County and how the county plans to dole them out.
WCNC Charlotte's Hunter Sines has the details.
The county says there are roughly 100,000 kids between the age of 5 and 11 who live in Mecklenburg County. But when they will become eligible to get vaccinated sometime next month, it turns out there won't be that many vaccines available. Earlier this year, we all remember the scramble to book an appointment, driving around town to find a vaccine clinic. Well, the mad dash could happen again when kiddos are finally eligible to get a shot.
This has been an area of great concern for us. Obviously, many of our children are still unable to be vaccinated.
Mecklenburg County Deputy Health Director Dr. Raynard Washington says final approval for the Pfizer vaccine for kids 5 to 11 could be coming soon.
We could have approval for kids 5 to 11 as soon as November the 3rd, if the CDC director makes a recommendation at that time.
Washington says Mecklenburg County was told Tuesday they'd get roughly 13,500 doses in the first shipment, nowhere near enough for the 100,000 kids in that age range who live in the county.
So are you pushing for more, I hope?
We believe that we'll have adequate supply for everyone within the first couple of weeks. However, of course, we will not be able to vaccinate 100,000 people in the first couple of weeks.
As for the Pfizer doses that are already in the county and not being used, they cannot be simply given to children.
Dosing is a little bit different, and so it is packaged differently and is separate. It has to be drawn from a different vial.
The county will give the shots to local medical providers like Atrium and Novant, who will then roll them out in hopes of more community protection. In Uptown, Hunter Sines, WCNC Charlotte.